And what's your opinion about the dentist?
See, dentists are natural cosmetologists, but they
Okay.
too have training plus proper certification. Many dentists, sorry to say this, they have some inappropriate certifications like Germany, Sweden, international. These are all not working. This is not for just practicing. If any case is going to the consumer forum, they will be stuck.
तो अगर मैं सोशल मीडिया पे आके हार्ट से रिलेटेड कुछ वीडियोस बना रहा हूँ, बिकॉज ईएनटी की वीडियोस आर नॉट दैट फैंटेसी के लोग उससे इंगेज हो पाए, तो क्या वो सही हो सकता है या गलत हो सकता है?
100% सही है, बोलना भी चाहिए. Why? Because there was a case consumer forum that the doctor was punished for not alerting the patient, taking the treatment line in such a way the cough was taken simply because that was an indication before the heart attack.
सब हेयर ट्रांसप्लांट डॉक्टर भी बहुत ज़्यादा फेक आ गए हैं, तो क्या क्या कर सकते हैं?
One council, one association, one forum you have to check.
Okay.
So which council they are, which association they are, and which forum they are, because forum is very much necessary.
मुझे किसी कॉस्मेटोलॉजिस्ट से कंसल्ट करना है, तो जब मैं उनके पास जाऊंगा तो मुझे क्या क्या डॉक्यूमेंटेशन या क्या क्या उनकी डिग्रीज को चेकआउट करना चाहिए सो दैट आई कैन गेट बेस्ट रिजल्ट?
आप एक सिंपल आइडियोलॉजिकल सवाल पूछिए डॉक्टर से. डॉक्टर, आपने कोई बेसिक यूजी तो कोई मेडिकल डिग्री तो किया होगा, वो तो आपको पता है. मेडिकल काउंसिल, डेंटल काउंसिल और आयुष काउंसिल इफ दे आर इन ऑल्टरनेटिव. कॉस्मेटिक वर्क के लिए आप उनसे पूछिए आपके पास क्या सर्टिफिकेशन.
तो सर एक एसोसिएशन है IADAVL, तो वो डेंटिस्ट को प्रैक्टिस करने से रोकते हैं कि आप जो है कॉस्मेटोलॉजिस्ट या डर्मेटोलॉजिस्ट की प्रैक्टिस नहीं कर सकते. वाई?
See, you have said rightly. IADVL stands for Indian Association of Dermatologists, Venereologists, Leprologists. So it is the association, largest association in India, representing dermatologists.
ओके.
वो क्यों रोक रहा है? I will tell right thing also, what is wrong in that also.
नमस्कार दोस्तों, तो स्वागत है आपका एक और नए पॉडकास्ट में. आज का पॉडकास्ट कुछ अलग है. मैंने भी नहीं सोचा था कि एक ऐसा पॉडकास्ट प्लान करेंगे, लेकिन इन डॉक्टर्स सबसे इम्पॉर्टेंट होता है कि सही व्यक्ति अपना सही काम करे. तो डर्मेटोलॉजिस्ट हो जाए, कॉस्मेटोलॉजिस्ट हो जाए या डेंटिस्ट हो जाए, इन तीनों टर्म में ना एक, मैं कह सकता हूँ, ट्रेड वॉर, कि एक दूसरे को ना ब्लॉक किया जा रहा है कि कौन क्या करेगा, कौन किसके लिए स्पेशलाइज्ड है. ये बहुत इंपॉर्टेंट होता है. आज के टाइम पे हम देख रहे हैं कि बहुत सारे ऐसे केसेस आ रहे हैं कि आपने कोई फिलिंग करा ली या आपने कोई बोटॉक्स करा लिया, आप किसी डेंटिस्ट के पास गए और आपको रिजल्ट इनएप्रोप्रिएट मिल रहे हैं, लेकिन आप डॉक्टर को चेंज नहीं कर सकते. आप उनसे ये नहीं कह सकते कि आपने गलत काम कर दिया. आप बस अपना डॉक्टर चेंज कर सकते हो. कई बार ऐसा होता है कि लोग रिकमेंड करते हैं कि मुझे भाई ये स्किन केयर कराना, प्लीज मुझे बताएं किसी डॉक्टर जो अच्छे डॉक्टर हो. तो ऑब्वियस है, देखो बुक सभी की एक है, सब प्रैक्टिस भी सभी की एक है. कुछ छोटी छोटी मिस्टेक्स हैं जो डॉक्टर्स करते हैं. तो आज उन्हीं गलतियों को समझने के लिए आज हमारे साथ हैं कॉस्मेटोलॉजिस्ट काउंसिल ऑफ इंडिया के प्रेसिडेंट डॉक्टर VK स्वामी सर. नमस्कार सर.
नमस्कार.
कैसे हो आप?
बढ़िया है.
तो आज हम समझेंगे कि किसकी क्या ड्यूटी होती है और किसको क्या करना चाहिए. तो डॉक्टर साहब, सबसे पहले तो आप एक शॉर्ट इंट्रोडक्शन, सो दैट हमारी ऑडियंस आपसे कनेक्ट हो पाए.
मैं डॉक्टर VK स्वामी हूँ. I have triple advantage I could call. मैं basically from medical professional, in that I am a dentist, and after clinical practice I was into forensic odontology.
Okay.
I am officially having masters in forensic odontology, India's the one and only world's university for forensics.
Okay.
इसमें I was the first officially trained by the university, and also I am a lawyer. So medical, legal, and forensic, these three bases made me to get into this council that is called Coctracy, Council of Cosmetology, Trichology, Regenerative Aesthetic Science of India. Basically, many cosmetologists approached me around 7-8 years back. Sir, you please help us in establishing this field, because a lot of dentists by the time brought this field to this country, but right now the same dentists who brought this field in the name of cosmetology, now they are trying to vacate the field because of some misconception, misunderstanding. So that is matter of concern for me as a medico legal expert also. So yes, I am currently the president of Coctracy, the Council of Cosmetology, Trichology, Regenerative Aesthetic Science of India. And if you ask me which doctors, I would say all the medical professional and related professional can become a cosmetologist according to their own level.
डॉक्टर साहब, फर्स्ट ऑफ ऑल क्वेश्चन आई वांट टू आस्क यू कि क्या डेंटिस्ट को सिर्फ टीथ तक ही सीमित रहना चाहिए या वो कुछ और भी प्रैक्टिस कर सकते हैं?
देखिए, डेंटिस्ट मतलब they are into head and neck region, precisely into the oral cavity, but they study anatomy, physiology, biochemistry, pathology, microbiology, pharmacology, medicine, surgery. Only final year they are into only dental. And if you compare MBBS versus BDS, year wise almost same. MBBS are 4.5 years plus 1 year internship.
Okay.
BDS also almost same because of this counseling and late admission. We consider both same, otherwise it's 4 years instead of 4.5 years.
Okay.
And in subject wise, if you say only gynecology, ENT, ophthalmology, forensic medicine is missing in BDS. That is present in MBBS. But if you look into their practice, even MBBS not doing ENT surgeries, ophthal surgeries after that. So is equivalent, not same, but you can say equivalent.
क्या डर्मेटोलॉजिस्ट फिलर एंड बोटॉक्स देने में कम प्रिसाइज्ड होते हैं आपके हिसाब से?
Dermatologists, they are into skin and hair basically, and they are expert in all the diseases happening there and the treatments management medically. So there is a dichotomy of medical versus surgery. If you go to a cardiologist, DM cardiologist cannot do open heart surgery.
Okay.
So likewise, they are good in diagnosis, prescribing the medicines, but doing the procedure, they need to get training, specialized training after their MD dermatology or diploma dermatology into Botox and fillers. So not all dermats are practicing these cosmetic procedures, particularly as you mentioned, Botox and fillers. They need a specialized training because they have to get their hand skills, because medical background, the skill is not required at all. They can prescribe medicines, understand the disease, suggest medicines, management. So when you are getting into the procedures, cosmetic procedures, particularly on face, they need to have specialized training.
Without any MBBS, dentists are doing face injection. Is that legal or illegal?
See, if you ask me, only dentists can do injection in the face routinely, because any procedure, dental procedure, they have to give anesthesia, local anesthesia. So that is through injection only they are giving. And as I told initially, both are studying the same medical science. The body is not a machine. The same nerves passing through the face, reaching up to the full body. The 12 cranial nerves, it's there from the brain, passing through the oral structures. Okay. If you ask me, day before yesterday we had a plane crash. Very sad news. So if you ask me, the connection between the flap in the wings and the cockpit, you cannot say pilot cannot control the flap. It's connected.
Exactly.
So if anybody is saying dentist will concern only about tooth, that is not only injustice, that is immaturity.
Is that true that dermatologists जो हैं वो dentist से insecure feel करते हैं?
Not all, but those who propagate the ideology, dentists should not do cosmetic procedure on their own domain, that is head and neck. I think they might be, why I am saying, they strongly believe if dentists are absent in this field, they can do monopoly.
Okay.
And not all dermats. And in fact, if you ask my assumption, if 100 dermats are there, hardly 10 to 20% are into cosmetics.
Okay.
So others are doing their hardcore dermatology, skin and hair.
And what's your opinion about the dentist?
See, dentists are natural cosmetologists, but they too have training plus proper certification. Why I am saying certification? Because right now, particular group of dermatologists, they try to stop dentists, even they stop the supply.
Okay.
Like Botox, they wrote Botox company an email, don't supply to dentist and cosmetologists. So in these issues, why dentists are not coming out? They are not vocal because they are not confident about their qualification. Many dentists, sorry to say this, they have some inappropriate certifications like Germany, Sweden, international. These are all not working. This is not for just practicing. If any case is going to the consumer forum, they will be stuck. The civil case will become a criminal case because they don't use proper certification. So I suggest proper documentation for your skill. I agree, you might have possessing the skill, but in the court, in inquiry, in the consumer forum, they don't look into your skills basically. They look into your document. Legally, we used to call it res ipsa locator. Means document speaks for itself.
तो तेलंगाना के कुछ एक हमने ऐसे इश्यूज सुने हैं कि डेंटिस्ट को वहाँ बॉयकॉट करा जा रहा है बिकॉज दे आर अर्निंग इन द नेम ऑफ ब्यूटी. इज दैट ट्रू और रॉन्ग?
तेलंगाना इश्यू में क्या हुआ? In Telangana, certain group of dermatologists strongly believe that dentists are not qualified at all.
Okay.
They strongly believe they practice quackery. And they wrongly believe what is quackery. Quackery is defined. It can be defined in simple words. I am saying, if you are leaving your system of medicine, practicing the other system, it is quackery. I agree. For example, an Ayurvedic physician, a homeopathic physician, they are leaving their science and come to modern medicine. That is quackery. But dentists are already in modern medicine. If you go to your dentist, they write the medicines. It may be a painkiller, it may be antibiotic, it may be for pantoprazole 40 mg. So all these are prescribed by the same medical community. So where is the quackery? Secondly, their domain. Head and neck is their domain. In their domain, they orient towards cosmetics. That is natural extension. I agree, there should be proper certification. But that doesn't mean they are practicing quackery.
Okay.
So this issue is going on in Telangana. So that is why they are being, I think some FIR also filed against dentists turned cosmetologists. So many dentists quit their practice from cosmetology. They are coming out. So this is the matter of concern now. Because ultimately the public will be the sufferer.
Exactly. And when you are doing an aesthetic treatment is that I think in terms of doctorate it's not right. So they are doing I think wrong practicing. तो अगर उनको कोई कहीं से certification करना है for their appropriate training तो कहाँ से कर सकते हैं?
See, you have to follow the general medical principle when there is no proper discipline, formal education, MD or MS or MDS in the particular field like cosmetology, you have to rely on your natural upskilling and you have to document and you have to get membership and fellowship with the concerned council. Council in the sense many thinking only medical council, dental council, pharmacy council, all these. These are all statutory bodies.
Okay.
Other than that also, for example, in your field, there is a Advertising Standard Council of India. It is non-statutory, non-constitutional body. It is a self-regulatory body. Likewise, in cosmetics, there is a council called COCTRC, Council of Cosmetology, Trichology, Regenerative, Aesthetic Science of India. There, you have to submit an undertaking that I am not practicing hardcore dermatology. I am concerning only with cosmetology of my domain. Done. So that is a proof. Tomorrow, some complaint, some FIR, some inquiry, some court case, some consumer forum calling you, you can produce that predated affidavit using the COCTRC as a witness. So you are saved. So this work. Secondly, don't accept any PG diploma, Skill India or any vocational certification. These are all coming viewed as a creating a perception to the public. That is why dermats are opposing. Dermats are not openly opposing your skills, your talents. They are opposing your projection. I could see many Instagram profile of dentist turned cosmetologists. They never mention they are from dental background. They simply call aesthetic doctor, celebrity cosmetologist. So this is deceiving. So definitely FIR will be filed for this action, not for not possessing skill, but how you project. This is what exactly happening in Telangana.
So what would you think about the social media frame? Is that right when you are dentist but you are telling about the content on the topic of derma? Is that good?
Me, you are asking about myself. See, I am a medical legal lawyer. Time and again, I am getting phone calls from the dentist. Sir, I am practicing this cosmetology in this area for past 10 years. Suddenly now I am getting the notices from even the dental council. I told them dental council will definitely serve you notice because you be a dentist and you are in your board, you are calling yourself dentist and cosmetologist. So you are using dental council of India's frame to project you. You have to disassociate with the dental council. You have to claim, I am a dentist, I was a dentist, now I am extending naturally into the another domain after proper upskilling. You have to show your concerned body, concerned council. Then dental council will say, as long as our own 9 departments, we will regulate them. When they are learning new thing, dental council cannot stop them. It is fundamental right, Article 19(1)(g).
Okay.
Any citizen can learn, upskill and practice their own practice without any hindrance. Right to practice, Article 19(1)(g). Okay. Also, there is a fundamental duty under Article 51(a)(j). Means, for example, I am a dentist. 4-5 years I have studied. I have come out. If I am not doing any new thing, I am not excelling, I am not upskilling, that means I am derelicting my duty. I am not fulfilling my duty as an Indian citizen. I have to upskill. So, fundamental right, fundamental duty. And regarding the punishment, Article 21 says no person can be punished except the procedure established by law. Now you tell me there is no law. If there is a law, Dental Council of India at national level might have till the time announced all dentists should stop doing any cosmetic work in your area. But there is no such dictatum. There is no law. So without that law, if you are filing an FIR by perception created by another rival group, they will say we are not rivals, but we are talking about the facts. As a medical legal lawyer, I am telling this. I will tell in this in the court also. So that is why it's my duty to clear the air. What is right, wrong, what is legal, illegal, what is ethical, unethical, and what is the fact. Because if you see, dentists, 3rd year, they study oral pathology, one book, one subject. In that, edition 5, chapter number 16, 17, they study disease of skin and hair. Why did you allow them to study? And there is a disease called Steven-Johnson syndrome. The manifestation will be genitalia, skin and mouth. So a dentist, to diagnose properly, he should get a overall view. You cannot restrict in the oral cavity. It's premature idea.
So, for example, in a general way, I'm asking to you because you are a lawyer also. I'm a ENT doctor, and I know about something from related to my heart. तो अगर मैं सोशल मीडिया पे आके हार्ट से रिलेटेड कुछ वीडियोस बना रहा हूँ, बिकॉज ENT की वीडियोस आर नॉट दैट फैंटेसी के लोग उससे एंगेज हो पाए, तो क्या वो सही हो सकता है या गलत हो सकता है?
100% सही है, बोलना भी चाहिए. Why? Because there was a case, consumer forum, that the doctor was punished for not alerting the patient, taking the treatment line in such a way, the cough was taken simply, because that was an indication before the heart attack. You are talking about ENT. I am telling about even dentists. The first molar pain, we used to diagnose with the referred pain before heart attack. Shoulder pain, you might have heard, left shoulder pains. So it radiates to the first molar tooth. The lower jaw pain. Sometimes this joint, we call it temporomandibular joint. That also sometimes painful, inflammatory. That is indication of something is not right in your cardiovascular system. So it may be a myocardial infarction before heart attack. So every human body is not a machine. Every portion is interconnected. So definitely every specialist should naturally connect to the heart according to their own symptoms, signs. Nothing wrong in that.
एंड जो कॉस्मेटोलॉजिस्ट एंड डर्मेटोलॉजिस्ट के बीच में क्या दिक्कत चल रही है, ये दोनों आपस में इतना क्यों कॉन्फ्लिक्ट हो रहा है?
It's a matter of terminology. Cosmetologist is a common terminology. If you add cosmetology prefixing with any specialist, for example, cosmetic dermatology is totally with the dermatology. Cosmetic ophthalmologist, that means ophthalmologist, parent council, medical council had given them the ophthalmologist title, and they excel some aesthetic concerns. See, now you have decorated this studio. So this is called aesthetic sense. So as your expectation, aesthetic means suddenly dermatology will not come. Aesthetic means it's a science. And the word cosmetology had 2 words, cosmos, logos. Cosmos means what? Cosmic rays, cosmic waves, means existing. Logos means study. Cosmetology means you are bringing back to the normalcy.
Okay.
It's not about disease per se. You are, for example, some tanning happens. You are going to the sunlight. So when we are bringing back to the normalcy, the word is cosmetology. So now you tell me, who cannot prefix cosmetology? Any doctor.
Anyone, no.
They can orient. For example, if you ask me, who are all natural cosmetologists? Compare. It's not wrong to compare dentists versus dermats. Let me compare for ideologically. All dentists are naturally cosmetologists, but all dermats are not naturally cosmetologists. Why?
Why?
Because, see, without cosmetic sense, aesthetic sense also, a dermatologist can survive. You go to a dermatologist, you have some skin disorder, you clear it and come. Okay, no, not necessarily the dermatologist will be having aesthetic sense, cosmetic sense. That is extra fitting, no?
Okay.
But without cosmetic sense, dentist cannot operate. And then you go for fixing a tooth. So just functionally, if you fix the tooth, then it may look like a Dracula also. So naturally, the cosmetic sense is mandatory with the dental community. But with a disclaimer, not all dentists are fit enough to do cosmetic procedures. It is very sophisticated. Now it's grown. You have to have specialized training. Not only training, you have to document it properly.
Okay.
And if you claim inappropriate certifications, then naturally the dermats, not only dermats, anyone can file FIR. Even the patient can complain to the consumer forum. They will ask the compensation. And in terms of certification issue, the civil case may become criminal case also in terms of impersonation, cheating, and decepting the public, and lot of charges can be framed against the dentist.
Let's discuss something about in the perception of customer. If I am a client and you are a dentist, and if I am asking you कि क्या सर आप मेरा ये स्किन का यहाँ प्रॉब्लम हो गया है, क्या आप इसको भी देख के इसका भी कुछ कर सकते हैं? तो अगर आप वो कर रहे हो, ठीक है, और यू आर माई फैमिली डॉक्टर, हमारे बहुत पुराने टर्म्स हैं, तो क्या गलत क्या उसमें?
See, every doctor, not only dentist, every person in the medical fraternity should respect the approach of multidisciplinary. Means everything is interconnected. I told human body is not a machine. It's a systemic connectivity is there. It is not mechanical juxtaposition. It is systemically connected. So whenever the dentist getting a skin related issues, pathology, they have to refer the patient to a dermatologist. And it's called multidisciplinary approach. They have to refer. Nothing wrong in telling the patient, my domain belonging to this, and I am referring to you, and you have to follow them up.
And if I want a Botox or any other skin disease disorder जिसमें मुझे कंसल्ट करना हो किसी पर्टिकुलर डॉक्टर से, तो मैं क्या क्या देखूं कि इसके पास क्या क्या डिग्री होनी चाहिए, एंड ये कहाँ से सीखे हैं, कहाँ से पढ़े? बिकॉज मैनी फेक डॉक्टर्स आर कम फ्रॉम इन इंडिया कि मेरे पास ईरान से डिग्री है, मेरे पास टर्की से डिग्री है आजकल, और इसका ना सोशल मीडिया पे बड़ा एडवर्टीजमेंट हो रहा है इन टर्म्स ऑफ हेयर ट्रांसप्लांट डॉक्टर भी बहुत ज्यादा फेक आ गए हैं. तो क्या क्या कर सकते हैं?
See, first of all, you have to get into the basic registration to practice, license to practice, either medical council or dental council. But cosmetics is not a specialized PG or UG in India. So you have to rely on the bona fide upskilling, bona fide training by concerned body. Concerned body, I told Coctracy. The council, the name itself says Council of Cosmetology, Trichology, Regenerative Aesthetic Science of India. If you ask me, you have to check three things. First, their basic degree or qualification, whether it is in India, approved by Indian Council, and adjointly, you have to look into their cosmetology, for cosmetology, where they are affiliated. So, in that, one council, one association, one forum, you have to check.
Okay.
So, which council they are, which association they are, and which forum they are. Because forum is very much necessary in case of some dispute. You yourself may go to consumer forum tomorrow. By the time, who will come and represent that person? If the forum is there, you will get some justice. At least you will not get injustice. Nothing, nobody is representing, then you have to fight the full case. So I recommend Coctracy, Dysphagia, Medical Legal Forum. Dysphagia is for Dentofacial Aestheticians, Cosmetologists, Trichologists India Association. This is for the dentist turned cosmetologists. For dermatologists, medical council, as of now, they are not insisting of any specialized cosmetic training for dermats. That is also wrong. We have to point out. Dermatologists also should possess proper qualification.
Okay. And for the Botox and filler, क्या certification are necessary in India to practice that?
See, this is a particular treatment line, particular procedure. So separately, there is no separate degree for a particular procedure. But these are all done successfully by either dermats or dentists after their qualification getting into 1 year of fellowship program. Don't go for PG diploma, foreign degree, master's program, some university and all. It's all irrelevant because it's a medical field. So go for a professional regulatory council because there is no statutory body available for this field. So self-regulatory voluntary council, I already told. In your field, there is Advertising Standard Council of India.
Exactly.
Likewise, here Coctracy. Because without council, if you are having any issues, where to go, how to blame them?
आप help करते हो fellowship में? If I want to enroll in that fellowship?
Yeah, you can visit the website and you can give your basic credentials because you should be a qualified dentist or medical professional to get into this 1 year fellowship. See, 1 year fellowship, that is nothing new you are getting. There is no special license is granted. But there is a proof for witnessing your upskilling.
Okay.
There should be some third party saying that particular doctor has upskilled. He had done these many cases. They had submitted these many assessment for that purpose.
Acne, scars, pigmentation और skin tightening, क्या कोई dentist practice कर सकते हैं?
No, these are all coming under hardcore domain of dermatology. So if dentists getting these cases, they have to refer to the dermatologist. And there is a problem in referring also. In Telangana, they have released one unique order. They told the particular association related dermatologist not to associate with dentists. This is anti-constitutional, illegal. This clearly shows there is a conflict of interest because you are a doctor. The government has spent on you crores of rupees to make you a dermatologist, and a particular organization is stopping you to associate with dentists for financial reasons or whatever reasons may be. That is illegal, unconstitutional, and this kind of news broadcast should go to the public to question these kind of wrong perceptions and projections.
डॉक्टर साहब, I want to ask कि मुझे किसी कॉस्मेटोलॉजिस्ट से कंसल्ट करना है, तो जब मैं उनके पास जाऊंगा तो मुझे क्या क्या डॉक्यूमेंटेशन या क्या क्या उनकी डिग्रीज को चेकआउट करना चाहिए सो दैट आई कैन गेट बेस्ट रिजल्ट?
आप एक सिंपल आइडियोलॉजिकल सवाल पूछिए डॉक्टर से. डॉक्टर, आपने कोई बेसिक यूजी तो कोई मेडिकल डिग्री तो किया होगा, वो तो आपको पता है. मेडिकल काउंसिल, डेंटल काउंसिल और आयुष काउंसिल इफ दे आर इन अल्टरनेटिव. कॉस्मेटिक वर्क के लिए आप उनसे पूछिए आपके पास क्या सर्टिफिकेशन है.
ओके.
वो सर्टिफिकेशन को आप पर्सनली इफ दे आर हैंगिंग इन देयर क्लिनिक आप पूछिए, देखिए वो किस रेगुलेटरी बॉडी का अंडर है. फॉर एग्जाम्पल, if they are mentioning the Council of Cosmetology, that Coctracy, it is there from that regulatory. Tomorrow some bad thing happens, untoward incident happens, you can go to the consumer forum, complain to the medical council. So this body may say right or wrong. There is a third person sitting on your behalf, public point of view. Nobody, nothing, some institute, private limited company, some foreign university, all we cannot clear their authenticity, or it may be some UGC approved university also. These are all not proper because it's a medical professional.
Okay.
For art, science, UGC approved university, they can grant a MSc degree or any other UG degree. But here, a doctor is practicing cosmetic procedures without counsel and without. Secondly, you have to look into the association. Which association the particular doctor is affiliated with.
बट मुझे जहाँ तक मुझे मेरी सोशल मीडिया नॉलेज से पता चला है कि अभी कोई एसोसिएशन या कोई ऐसे फॉरम जो है कॉस्मेटोलॉजिस्ट के लिए बनी नहीं है इंडिया में.
नहीं, इंडिया में बने नहीं और बनेगा भी नहीं बिकॉज वर्ल्ड में कहीं नहीं है.
ओके.
हियर यू हैव टू लुक इनटू सेल्फ रेगुलेटरी काउंसिल बिकॉज एवरीथिंग कैनॉट बी डन बाय द गवर्नमेंट. सी नाउ वी आर सैड अबाउट द एयर इंडिया प्लेन क्रैश. इट इज नॉट गवर्नमेंट, it is by private, but there is a DGC, it's government. So the authority for doctors, government cannot decide. IAS officers, IPS officers, they cannot decide which line of treatment to be given. So it should be by the peer group. But there should be a body which has protocol. So that protocol can be fixed only by the body. The institute or academy or the mentor, they are going to issue you a certificate on their own terms. And in fact, the Medical Council of Act, Dental Council of Act prohibits any senior doctor to issue a certificate to the junior doctor. So in that angle also, those certifications are not proper. If you go to consumer forum, the civil case become a criminal case because the particular doctor is decepting the public. So public should be asking the doctor which council you belong to. If they are saying medical council, dental council, you ask them again. That is okay for your basic license. What about cosmetic practice? Who is governing you? Tomorrow you are doing wrong thing. Where to go and get the clarification? You cannot go to the institute per se, because that institute person will say, in fact, they are not picking up the phone. I could see a lot of FIRs, the threats of raids. Today, the burning issue, Telangana happening. The institutes, and I don't want to name any particular institute, one famous institute, more than 60% of the cosmetologists from that institute is not responding at all.
Okay.
So that is why you have to come under a particular regulatory body. Let it be self-regulatory body, but be under a body. You have to check with that.
क्या फ्यूचर में डेंटिस्ट एंड डर्मेटोलॉजिस्ट का कोई कॉम्बिनेशन ऑफ ब्रांच आ सकता है? आपको क्या लगता है?
See, cosmetology, we are discussing dentists versus dermats. We are forced to discuss because of the burning issue, but this is not the case. Cosmetology is a common platform.
Okay.
Any doctor can orient towards aesthetic sense. They become cosmetic so-and-so doctor, cosmetic ENT, cosmetic opthal, cosmetic dentist, cosmetic dermatologist. So every doctor should have cosmetic approach, because nowadays hygiene, wellness, the definition has changed, because there is no endemic except after COVID. Everybody concerning about prevention point of view, reversal of diseases. Now YouTubers also reverting diabetes, gut wellness. So in that sense, cosmetology you cannot confine. Otherwise, growth will come. For example, you stop dermats or stop dentists for that matter. You don't enter into cosmetology. Let the field directly grow. How it will grow? It has to pick up doctors from other domain, and cosmetology should grow. If you stop everybody or a particular group of practitioners entering into cosmetology, then the loss is for the public, because you are losing the skill. And one more thing, dentists, why they should not quit the cosmetic field. They are 3 lakh plus in numbers, and around 50,000 already into the cosmetic industry. And if you compare the dermatologists, out of 18,000 from the particular association, only hardly 3 to 4,000 are into cosmetics, full-time cosmetics. So 152 crore population. Think about India's population. So it's kind of monopoly. You cannot allow a particular 3,000-4,000 to rule. Then the fees, definitely. So allow the dental community. It's cheap and best. Why I am saying cheaper? Because the number. And more public can be benefited.
तो सर एक एसोसिएशन है IADAVL, तो वो डेंटिस्ट को प्रैक्टिस करने से रोकते हैं कि आप जो है कॉस्मेटोलॉजिस्ट या डर्मेटोलॉजिस्ट की प्रैक्टिस नहीं कर सकते. Why?
See, you have said rightly. IADVL stands for Indian Association of Dermatologists, Venereologists, Leprologists. So it is an association, largest association in India, representing dermatologists.
Okay.
वो क्यों रोक रहा है? I will tell right thing also, what is wrong in that also. Rightly they are doing. Why? Because lot of dentists having their own personal certifications taken from wrongly. They never went to Germany, but they write FAM Germany, Sweden, Iran, and they are using Skill India. That is meant for vocational training, beautician, electrician, plumber, fitter. I am not degrading their profession, but that is not, they are not doctors. They cannot treat the human bodies. So when you are holding this certification, it's a duty of the professional association to clear the public. These certifications are not going to save you in case of any mismanagement, any maloccurrence, any misadventure with the treatment. Then these certifications will land up in criminal cases.
Okay.
You will not even get the compensation. So that is why they are stopping. And why in the sense of wrong. Why I am saying it's wrong? Being an association, you are not meant for cosmetology. Your bylaw is not into cosmetology. You derive something out of the bylaw. Being an association, you cannot become a government representative or statutory body or regulator for the whole nation, whole public. You concentrate, because here the beauty is dentists are not stopping their mats. Whether they are qualified, not qualified, straight away from MD, when they are practicing cosmetology, dentists are silent. But in the opposite, the IADVL sponsored few individuals, they form even some anti-quackery cell.
Okay.
It is not legal. It's not monitored by court or any government authority. And they manipulate the news to the state medical council, and they are campaigning to stop. So it is wrong. And the dentists, affected dentists can go and report to the registrar of societies where they got IADVL license. They can complain. And you can complain in the competition commission also.
Okay.
But why they are not complaining? Because they themselves not having proper certification, because they are already blackmailed. When they come out, then there will be case, extra 2-3 cases on their head. So that is why. So without proper certification, dentists cannot raise their voice now, as of now.
As a legal advisor, who can approach you?
Anybody can approach. I already people are approaching some of my interviews in the YouTube, some meetings, Zoom call. They can contact me for any legal advice. If any FIR is filed against you. So legal help, I am always there. But coming to me, you have to make your documents clear. Otherwise, I cannot help.
As a personal audience, what क्या गलत हो रहा on social media?
There are two group of people. One group of people already having cosmetology certification, as I told him, inappropriate. They are fighting for their rights, but that is technically not possible. The other group, the Dermatology Association and the representatives, they are going to the public saying about non-dermats who practice cosmetology are quacks.
Okay.
So the public are confused now.
What is quacks? आपने कई बार कहा.
See, quack means I am practicing some other medical field, like homeopath, Ayurvedic, naturopathy. When I am using injection, modern medicine, then being a doctor also I am a quack. And if scene is like this, any uneducated person, non-doctor, practicing medical profession also quack. But the irony here is, both dentists, dermats are part of modern medicine. Calling each other quack is wrong, and it is purely of financial interest. But they will deny, both the parties will deny. But as a legal expert, I could see the difference between association and council. Association meant for their own members' benefit.
Okay.
Council is for the public safety.
Okay.
So here also, even though the Coctracy is not a statutory body, not a constitutional body, it's a voluntary self-regulatory body.
Okay.
And it should work for a betterment of the public, and its opinion in the form of affidavit will be valid in the court of law as a natural stakeholder. But an association cannot claim this facility, because association is meant for public, not for public, primarily for the personal benefit of the members.
तो जिस काउंसिल ऑफ बॉडी के आप प्रेसिडेंट हो, वो सेल्फ रेगुलेटरी है या गवर्नमेंट बॉडी है?
No, it's I told it's there is no government body apart from medical council, dental council, because cosmetology is not needed any special license. It's an upskilling, bona fide upskilling. So it's a voluntary self-regulatory body, as I already told. In your field, Advertising Standard Council of India. In the similar way, it is there in the cosmetic field. And immature people will say it's not a council. It's a namesake. Then it's applicable for
self-acclaimed council.
Because in modern world, government cannot do everything.
I know that.
Today we don't have our air carrier, passenger air carrier. We have sold to Tata. So everything we depend on government. For an argument, think about government is regulating. So government will not decide which filler to be used, which Botox, how much, what is the dosage, which line of treatment, whether it is for the chemical peel or any RF or lasers. So these are all, you leave it to the professional regulator let it be self-regulatory, but there is a body, there is a protocol, there are qualified people. Even government forms and some council, there will be the same people who are all in the field. Government cannot bring people from heaven.
Done. तो डॉक्टर साहब आप बता रहे हैं कि डेंटिस्ट का एक बहुत बड़ा नंबर है कि अराउंड 3 से 4 लाख डेंटिस्ट हैं इन इंडिया, तो क्या वो एज एन डर्मेटोलॉजिस्ट या कॉस्मेटोलॉजिस्ट नहीं बन सकते क्या, और वो क्यों नहीं आना चाह रहे हैं?
डर्मेटोलॉजिस्ट तो नहीं बन सकता बिकॉज डर्मेटोलॉजी इज इनटू MBBS and after that you have to do diploma or master's MD.
Done.
But dentists can upskill in various fields.
Like
I could see dentists are saturated. Many people are saying 3 to 4 lakhs means it's a big number. So I request dentist community, dental community, they have to concentrate on beyond their conventional treatments like scaling, drilling, plucking, and other filling, artificial teeth and all. Every dentist are doing. So if you want to make edge over others, you can get into this cosmetic field, of course with proper documentation as I told. Then you can concentrate on implants. There is no PG in implants. There are 3 different PGs are taking this, like prosthodontists, periodontists and oral maxillofacial surgeons. All 3 are doing this. So general dentists also, there is no harm in learning. There also there is a council, OMILOCI, Oral Maxillofacial, Implantology, Laserology, Oncology Council of India.
Okay.
So under this council, if you get into a fellowship, never ever go for PG diploma or any other formal degree because it is not available, it's not legal. So go for a upskilling under fellowship.
Okay.
See, fellowship means there are 3 kind of fellowship. One is funding, the other one is PhD, the third one is medical upskilling. That is called a fellowship.
Okay.
So the third one is my concern. You go to the fellowship and there is lot of scope in weight management, wellness, metabolic balance. As I already told, YouTubers also now doing reversal programs, diabetic reversal, obesity reversal. So dentists can use their medical and dental knowledge because mouth also the source of digestive process. If you are not digesting properly with the thyroid inside the mouth, then it may land up in metabolic disorders. Even diabetes also there is a connectivity.
Okay.
So dentists can get into this and connect a dietitian and you can form your own metabolic clinics, and there also there is a council, ICMRP, Hydro Council of Metabolic Balance and Reversal Program.
Okay.
And the other thing, I request all the dentists to get into the screening of malignancies, oral cancer. Today India is the hub of oral cancer. So that also dentists can expertise. There is a council, ICMSP, Hydro Council of Malignancies and Surgical Protocol. So you have to identify different councils for different emerging discipline. These are all self-regulatory bodies, but yet powerful to protect you, to upskill you, to set the protocol. So, and last but not the least, many dentists are facing legal issues, regulatory overreach, raids. Recently in South, there is a city called Vaniambadi. It's not a city, a small town. There one saline bottle is linked to 8 deaths, neuromelioidosis, the new disease. And the government did not identify the outbreak initially, but after that there was a raid conducted by the joint director of the health authorities, and they have pointed out one dentist. He was saying that I was being scapegoated to this. I am innocent. So there are a lot of issues happening when you are having your own clinic in your name. Go for corporatization. You corporatize your clinic. Need not be having multiple chains. You have one clinic, one chain, one corporate is possible. So you can approach me also for that, for the advice.
Okay.
So that is 50% of your problem, and your authenticity and authority will develop. You corporatize, have a brand name. Inside the brand, if you do multiple things, that is allowed. That is allowed. When you are being a dentist, then you become master of all trade, then you are being implicated wrongly.
And the last question is कि as if now आपको क्या लगता है कि dentist on an average क्या earning कर रहे होंगे in India?
See, dentists, if I say some number, it will be degrading to the dental community. But you can say dentists are least earning in the medical fraternity because of that numbers. And every dental clinic, dental hospital concentrated on the city. Metropolitan is becoming metropolitan discipline. It is not spread across the country evenly. That is the reason, and I name it structural unemployment. In structural unemployment, we have to retrieve some number of people from the pool and ask them to specialize into the emerging discipline. So exactly what we are suggesting now. Because everybody dentist, everybody doing scaling, filling, drilling, plucking, then public also bored, everybody same, and you cannot raise the price. So your prices are degrading. So certain group of people should evolve. They have to emerge into the emerging discipline, of course, with a disclaimer, proper certification, proper documentation.
Okay.
And last but not the least, the plane crash day before yesterday. We are all feeling very sad. There is a domain called forensic odontology. Foreign countries utilizing in the best way the dentists turned forensic odontologists. But in India, I am not seeing in the newspapers. You can say whether you would have seen.
No.
So that discipline, any dentist, BDS or MDS can pursue the career. It's very, I myself standing in front of you.
Okay.
I am the first official forensic odontologist in the country through National Forensic Science University under Ministry of Home, Government of India. So I tried to promote the field, but right now, if I say people are actually receptive, now people are calling me, they are asking me how to do the fellowship and all. So I recommend this is also one of the opportunity for the dentists, those who have interest. So it covers medical, legal, any of your friend dentists getting into patient troubles, consumer forum, in the fellowship of forensic odontology, you can get the coverage. It's basically giving dental knowledge to the doctors, dental knowledge to the lawyers and judiciary, giving legal knowledge to the dentists. It's two-way communication.
Done.
So this fellowship also can be recommended, and the concerned body is CAFO JPM, Council of Accredited Forensic Odontologists, Jurisprudencia Medicinal. So fortunately, I am there also as a legal advisor.
क्या बात है. And you are also a president. It's a honor कि आप यहाँ आए. आपने इतनी इंफॉर्मेटिव बात लोगों को बताया. आई थिंक ऑडियंस कनेक्ट कर पाएगी कि व्हाट इज द मेन इशू एंड द मेन कॉज जो हमने इस वीडियो में, इस पॉडकास्ट में डिस्कस किया है. एंड अगर आपको कोई केस आपको ऐसा लग रहा है कि आपके नियर बाय कोई डॉक्टर हैं जो गलत प्रैक्टिस कर रहे हैं, या उनके पास वो डिग्री नहीं है, फिर भी वो डर्मेटोलॉजिस्ट हैं या कॉस्मेटोलॉजिस्ट हैं, या उन्होंने आपके साथ कोई मेडिकल इशू गलत कर दिया, क्योंकि बहुत सारे लोग कंप्लेन ही नहीं करते. कोई बोटॉक्स करा लिया, फिलर करा लिया, या कोई आपने डॉक्टर ने प्रिस्क्राइब कर दी मेडिसिन, वो आपको साइड इफेक्ट कर गया, आपने कहा छोड़ो, परे जान दो, क्यों इस पर ध्यान देना, किसी और डॉक्टर से बात करते हैं. प्लीज़ ऐसा नहीं, आप सर की हेल्प ले सकते हैं, कोई भी हेल्प ले सकता है. सर एज अ लॉयर, एक लीगल एडवाइजर भी आपको हेल्प कर सकते हैं. तो कमेंट सेक्शन में आके आप ज़रूर बताना. एंड प्लीज़ वीडियो को लाइक कर देना, शेयर कर देना, एंड चैनल के सपोर्ट के लिए सब्सक्राइब ज़रूर कर लेना. एंड डॉक्टर वी के स्वामी सर का नंबर आपको स्क्रीन पर आ रहा होगा, बार बार बीच में सोशल मीडिया हैंडल भी आ रहे होंगे, तो आप कनेक्ट कर सकते हैं डायरेक्टली सर से. एंड थैंक यू सो मच सर, आप यहाँ आए. फिर मिलते हैं एक नए वीडियो में, एक नए पॉडकास्ट में. तब तक के लिए नमस्कार, राधे राधे.